Disorders of menstruation: amenorrhea, oligoamenorrhea, menorrhagia, metrorrhagia, dysmenorrhea. Amenorrhea. This is the absence of menstruation. It can be classified as follows: apparent or cryptomenorrhea, primary amenorrhea, or secondary amenorrhea. Apparent amenorrhea. This is a concealed type of menstruation, and this is not a true type of amenorrhea because menstruation occurs but there is obstruction in the vagina, which may be due to imperforate hymen or vaginal atresia. The management of this type of amenorrhea can be surgical intervention for removal of the obstruction, for example, hymenectomy. Primary amenorrhea: menstruation that has never occurred because of various causes such as developmental abnormalities, failure of the uterus, vagina, and ovaries to develop. There could be absence of uterus and vagina but with normal ovarian function, or there could be no ovaries at all. Menstruation occurs thereafter ceases after it has been established for months or years. Hence, it is a symptom or sign and not a disease. The causes of this type may include physiological causes such as pregnancy, lactation, menopause, etc., emotional factors, glandular dysfunction, systemic disorders. Oligomenorrhea. This is frequent or in occasional usage, very light. Menstruation characterized by long intervals between menses, generally longer than 35 days. Oligomenorrhea is common at the beginning and end of menstruation. Menorrhagia. This is excessive or prolonged menstrual bleeding. Menorrhagia is a symptom. Some of the causes include lesions of the body of the uterus like fibroids, endometriosis, TB. Lesions of the cervix like cancer of the cervix. Lesions of the ovaries like estrogen secreting tumors and chronic infection. Complications of pregnancy like abortion, ectopic pregnancy. Treatment of menorrhagia. Treat the cause. For example, anemia as in diet rich in iron. Myomectomy is done for fibroids. Dilatation and curettage, though it is being discouraged. Foreign bodies in the uterus like intrauterine contraceptive, for example, loop should be removed. Metrorrhagia. This refers to irregular bleeding or bleeding between menses. Dysmenorrhea. This is painful menstruation. It occurs in three forms which include the following: primary, spasmodic, intrinsic. This is experienced before or during the first hours or days of menstruation. It may be continuous or spasmodic or colicky, accompanied by vomiting, sweating, fainting, headache, and malaise. Pain is felt in the pelvis and the lower back, then radiates into the legs. The causes of primary, spasmodic, intrinsic. The actual mechanism is uncertain, but other factors contribute to the condition like obstruction of the flow to the uterus by a narrow cervical os, stronger uterine contractions. Vasoconstriction of the terminal arterioles and ischemia precedes the shedding of the endometrium. The spasms produce uterine pain. Hypermenorrhea, which is associated with clots, which may lodge in the cervical canal, causing pain. Treatment of primary spasmodic, intrinsic. Maintain general good nutrition, good bowel habits. Analgesics like paracetamol, codeine, and aspirin. Moderate activities encouraged to relieve pain. Hormones like estrogen and progesterone pills. Dilatation and curettage is done.